What are the precautions a pregnant woman should take? The precautions a pregnant woman should take to prevent getting the infection is the same as what anybody should take, because the infection only comes from droplet. That is, it comes from your nose and your mouth, where either you're talking to somebody that has the infection, and then it reaches your respiratory pathway, right, where you take a breath. Now, how do you prevent it? That's the only way. Cover it with a mask and then maintain distance. Now, when you're a pregnant woman, you can't avoid scan centers, you can't avoid your monthly doctor's visits. In fact, a lot of doctors have reduced their monthly visits, and then they're consulting over the phone and things like that. But there are still some appointments you have to make it in person. What do you do then? Wear a mask. Absolutely wear a mask. Fix an appointment, go to your appointment on time, because everybody is scheduling the people's visits. You make it to the appointment on time, finish your appointment and leave from there. That's what you need to do. What is interesting about this infection is it doesn't seem to be causing a great havoc for women that are pregnant. This is very atypical, because a lot of people believe that pregnant women have a lower immune system and they're more susceptible to infections, which is the case for certain infections, but definitely not COVID. If you are COVID positive, there are so many cases of women coming out just normally, just fine, and you will do just well. That doesn't mean you should be callous about the precautions you're taking. That just means if you get it, you don't need to get desperate. A lot of cases where a delivery is done with the entire staff wearing masks, you might have to go through labor wearing a mask, but at the end of the day, you need to be safe and your baby needs to be safe.